So at the moment we have 5 medical projects in Afghanistan. We have a trauma hospital in the northeast in Kunduz. We run pediatric nutrition activities and IDP general outpatient consultations, along with COVID treatment in Herat, which is in the west of the country. In the south, we are supporting in Boost Hospital, which is the main regional hospital for Helmand province, and we support in all of the main departments. So that includes maternity, pediatrics, surgical and general inpatient care. And then in Kandahar, we are running a TB program, and at the moment the team are assessing opportunities to move out into the districts. In Host, we run a very big maternity hospital. The hospital is in Host City, and we are supporting 8 comprehensive health centres in the various districts outside the city and the Host Provincial Hospital. So despite all the recent changes in the country politically and security-wise, MSF has managed to maintain all of our medical activities in those 5 hospitals around the country. It hasn't been without its challenges, but our core objective is to keep our hospitals open and to keep the doors open for our patients. First of all, I can only speak really about what we witness in our MSF projects. And it does vary. In Lashkargah, since the end of the conflict, a couple of weeks ago, we're really observing that the Boost Hospital is completely overwhelmed with patients, and that's because all of the other health facilities are no longer functioning. So this is putting quite a big burden on our team in Lashkargah at the moment, but again it underlines the importance of the fact that we are still present and the hospital is still open. In Kunduz, on the other hand, because there are no more conflict activities, we're seeing a change in the type of patients we receive. So it's no longer just violent trauma cases that we receive, we are also receiving accidental trauma cases. So, for example, people who have suffered a road traffic accident. In Host, it's a bit different again. Although we have opened up our admission criteria and we accept any mother presenting, we are observing that we have a slight decrease overall in the numbers of mothers coming for delivery at the hospital. And through our contacts with the primary healthcare centres in the districts, we are hearing the same thing. So we can only guess that this is because people are still a little bit hesitant to travel around. Perhaps there are difficulties with transport and such like, which is preventing mothers from going to the clinics as they normally would for delivery. It is a challenging moment. We are facing many issues at present related to lack of movement options around the country, which makes it difficult to move staff, move teams in and out of the projects at present. We are also facing similar kinds of challenges with supply, being able to ensure that we have all the necessary medical items in the projects. But our teams are working very hard to clear the warehouses and put supplies in trucks and move them to the projects. We are working very hard to find ways around all of these obstacles, and so far it has not meant that we had to interrupt or limit any of our medical activities, and I do believe we will find a way to manage all of these things. Has the health system managed to meet the needs of the Afghan people in terms of medical care? I would say no, it is seriously underfunded, which therefore means there is not enough funding to pay enough staff, to provide enough medical equipment and medications and supplies to actually match the numbers of the population. So we have observed over our years in Afghanistan that there are still quite significant gaps. That's not to say there have not been improvements, but there are still quite some considerable gaps. So the new challenges that we can anticipate for the Afghan health system now in the aftermath of the change of government is very concerning reports that main donors like the World Bank and IMF no longer going to continue their funding. This is particularly crucial for the health system because the World Bank has been the main donor up till now. What does this mean for MSF? It means we're going to see more gaps in healthcare for the communities that we're in, and we could therefore anticipate that we will receive a lot more pressure to scale up our activities. Certainly we have seen more patients in Lashkargah. This is where we see it most noticeably, and as I explained before, that is because the majority of other health facilities in Helmand are no longer functioning, which means essentially the only place that patients can come to receive care is at the MSF supported Boost Hospital. In the other provinces, the pattern is a bit different. In Kunduz, as I mentioned, we're seeing a bit less. But I do expect the numbers will increase again as the situation stabilises and people start to feel more free to move to access care. And I would say the same for Horst. I think the decreasing numbers that we are hearing about in the district health centres, I think this will change soon. Will MSF continue? Of course we will. We have absolutely no intention to leave the country.